You don't just fall apart one day. Illness in your later years rarely arrives like a thunderclap. Instead, it begins like a whisper in the background, easy to overlook, easy to explain away. A few extra naps, a forgotten meal, a strange heaviness in your chest after bending down to pick something up. You tell yourself it's just part of aging. You've earned the right to slow down. But sometimes, those subtle changes, they aren't just the years talking. They're warnings, gentle alarms your body sends before something serious happens. If you're over 70, your body has become both wiser and more delicate. It's still strong, still holding you up, but it no longer bounces back the way it used to. That's why it's so important to listen closely when something feels different, because many dangerous health problems don't start with pain or panic. They start quietly. That's why this video matters. This isn't about scaring you. It's about equipping you, protecting you, and giving you the power to respond early. Before a small issue becomes a hospital visit, you deserve to stay strong, to stay here, to live fully and safely. And the people who love you, your spouse, your children, your grandchildren, your friends, they want that too. So let's take a look at 5 silent but serious health warnings your body may be giving you. Warnings that often go ignored until it's too late. Number 1. Sudden fatigue. When your energy quietly slips away, there's tired, and then there's something deeper. You might notice you can't do the things you used to, like walking across the house without stopping, or finishing your chores without needing a nap. Maybe it takes you twice as long to get dressed, or you feel winded just going from the bedroom to the kitchen. You try to brush it off. I'm just tired, you say. I'm getting older, but deep down it feels different, not the usual tiredness after a long day. This is a kind of exhaustion that clings to you, even after sleep. Sudden or increasing fatigue can be your body's way of saying something's wrong beneath the surface. In many cases, this type of fatigue is one of the first signs of heart trouble. When your heart isn't pumping blood as effectively as it used to, your muscles and organs get less oxygen, and you begin to slow down. Fatigue can also be a sign of low thyroid function, undiagnosed diabetes, dehydration, chronic inflammation, or even depression, which often hides behind silence and sleepiness in older adults. Take the story of Margaret, age 76. She used to walk her dog every morning, tidy up her kitchen and cook for herself. But over a few months she started skipping the walks. The kitchen was messier. Meals came from the microwave. She said, "I just feel worn out." Her daughter insisted she see a doctor. It turned out she had low red blood cell levels, anemia, which was making her heart work overtime and her body feel like it was moving through mud. With treatment and care, Margaret slowly got her energy back. But if she had waited longer, it could have turned into something far more serious. So don't ignore your body when it starts asking for more rest than usual. Don't wait until the stairs become impossible or brushing your hair feels exhausting. New persistent fatigue isn't just part of aging. It's your body asking you to pay attention. Listen to it. Trust it. Get it checked. Because your energy isn't just about movement, it's about life. Number 2. Unexplained weight loss. When the scale tells a story, you didn't approve. It might seem harmless, maybe even a good thing. You notice your clothes are fitting looser, your face looks a bit thinner, and the number on the scale is dropping. And you haven't even been dieting. You shrug it off at first. I guess I'm just not as hungry these days. But inside there's a quiet concern. Why am I losing weight without trying? Unexplained weight loss, especially when it happens over weeks or months, can be a sign that something serious is happening inside your body. It may indicate issues with digestion, your metabolism, nutrient absorption, or even a developing illness. Sometimes it's the result of a chronic infection, thyroid disease, or uncontrolled diabetes. In other cases, it may be a warning sign of cancer, especially if it's paired with loss of appetite, fatigue, or changes in bowel habits. Consider George, 78. Over the course of 3 months, he lost nearly 15 pounds. His pants were loose, and his wedding ring nearly slipped off one morning. He thought it might just be the stress of missing his old friends from the community center, which had closed during the winter. But his daughter, concerned by his weight loss and constant tiredness, encouraged him to see a doctor. It turned out He had a slow-growing stomach tumor, small enough to treat but only because they caught it early. George underwent care, got support with nutrition, and today he's stable, thankful that someone noticed what he didn't. Weight loss doesn't always mean something bad, but it should always be investigated, especially if you lose more than 5% of your body weight in 6 months without trying. Feel full quickly during meals. Start skipping meals because of nausea, bloating, or lack of appetite. Begin to look more frail without explanation. Your weight tells a story about your health. If your body is changing, even quietly, let someone know. There's no shame in asking questions, only wisdom in doing so. You're not vain for caring about your body, you're valuing your life. Number 3, chest tightness or shortness of breath, when breathing becomes a burden. You've gone up that staircase 100 times. You've walked to the end of the driveway to grab your mail for years, but lately something's changed. You find yourself stopping halfway. You need to lean on the wall. You're breathing harder than you used to. Maybe there's a slight pressure in your chest. Not sharp pain, but a heavy sensation, like someone's pushing on your ribs from the inside. It's uncomfortable, but not unbearable. So you say nothing. But this kind of discomfort, especially in seniors, is one of the most often ignored signs of heart disease. Not all heart attacks happen with crushing chest pain. Especially in older adults, symptoms are quieter. Shortness of breath, fatigue, nausea, sweating, lightheadedness, or chest tightness that comes and goes. You might feel it after eating a heavy meal, during a light walk, or even while lying down. Evelyn, 81, was doing a crossword puzzle when she felt it. A dull ache in her chest and a strange tightness in her jaw. It passed within 20 minutes. She thought maybe it was heartburn. Her son insisted they go to urgent care just in case. The doctor told her, "You were in the early stages of a heart attack. If you had waited, you might not have survived the night." That warning saved her life. Chest tightness and shortness of breath can also signal lung disease, blood clots, or fluid around the heart or lungs. These conditions can worsen fast if ignored. If you experience any of the following, please seek help. Breathlessness doing light activities, chest pressure, even mild or brief, feeling winded while lying down, needing pillows to breathe comfortably at night, unexplained fatigue after minimal movement. Breathing is something we often take for granted until it becomes hard. And when it does, your body is begging you to pause, notice, and respond. Don't dismiss these signs as aging. Your lungs and heart may be quietly struggling. Help them before they shout. Number 4, frequent falls or sudden loss of balance, when gravity becomes an unexpected enemy. It always happens when you least expect it. You're doing something routine, walking from the kitchen to the living room, carrying a cup of tea, maybe just reaching for the phone that rang on the counter, and then suddenly, your foot catches on the rug, or your balance shifts just slightly and you're going down. It all happens so fast. 1 second you're upright. The next you're on the ground, dazed and hurting, wondering, how did this happen so quickly? In that moment, your world feels upside down, literally. Your confidence takes a hit. Your body feels more fragile than before. Maybe it's a bruise this time. Maybe it's a fractured wrist, or worse, a broken hip. But no matter how minor or major the injury is, the real damage isn't always physical. It's the silent fear that begins to creep in after the fall. The worry that it could happen again, the doubt in your own legs, the fear of losing independence. What makes falls so dangerous is how common they are, yet how often they're brushed off. Seniors blame their shoes, a clumsy moment, or the dog underfoot. But a fall is rarely just a fall. It's often a signal, your body telling you something has changed, something that needs attention. You see, balance is a beautiful, complex dance your body does without you even thinking. It involves your eyes, your ears, your brain, your muscles, and your nerves all working together in harmony. And when even one of those systems starts to falter, your balance begins to break down. Quietly at first, then suddenly. Let's look at some of the common causes. Inner ear problems. The vestibular system in your inner ear controls spatial awareness and balance. Even a minor issue here can make you feel unsteady or dizzy. Low blood pressure, especially when standing up quickly, can cause sudden lightheadedness or fainting, a condition known as orthostatic hypertension. Nerve damage or neuropathy, particularly in your legs and feet, reduces your ability to feel the floor beneath you. making it harder to catch yourself when you trip. Muscle weakness or loss of coordination, often due to decreased physical activity, malnutrition, or vitamin D deficiency, can make simple movements unstable. And in some cases, falls are the earliest sign of a neurological disorder, such as Parkinson's disease or early-stage dementia, even before other symptoms become obvious. But it's not just physical. Falls also affect the mind and heart. After a fall, many seniors develop a fear of falling again, which causes them to move less. That leads to more weakness, which leads to a higher risk of falling again. It's a cruel cycle, and it begins with just one unnoticed cause. Let me share the story of Helen, age 79. She lived alone in a cozy, tidy home filled with memories. One morning, while walking to the kitchen, she tripped over the edge of a throw rug, a simple misstep. She fell hard and fractured her pelvis. She lay on the floor for nearly 2 hours before a neighbor knocked on the door. Surgery followed. Weeks in the hospital, months of recovery. Helen lost her confidence more than her strength. She said afterward, "I always thought I was just a little clumsy. I didn't realize my blood pressure was crashing every time I stood up." Helen now wears a medical alert bracelet, checks her pressure daily, and rearranged her home to reduce hazards. She's still living alone, still cooking her meals, but she's doing it safely. And it only happened because she listened to what her body was trying to say after that first fall. So how do you know if you're at risk? Ask yourself, have you stumbled or tripped more than once in the past few months? Do you feel dizzy or disoriented when getting out of bed or standing quickly? Are you using walls or furniture for support without even realizing it? Do your legs feel weaker or more tired than they used to? Have you stopped going out as much because you're afraid you might fall? These are not things to ignore or be embarrassed about. In fact, addressing them shows strength, not weakness. Talk to your doctor about a balance assessment. A simple test can measure your fall risk in minutes. Ask about physical therapy, which can improve strength and coordination. Review your vision, hearing, and especially your medications, since some prescriptions increase dizziness or lower blood pressure. And if your doctor recommends a cane, walker, or grab bars, please don't see it as a sign of failure. It's a sign of wisdom. You've made it through a lifetime of storms. You shouldn't let a slippery rug take you down now. You haven't come this far in life just to fall. Number 5. Changes in memory or personality. When you start to feel like a stranger to yourself. There's a moment when you stand in a room and think, why did I come in here? You laugh it off. Everyone does that, right? You misplace your keys, your glasses. You forget the name of a neighbor you've known for 15 years. You repeat a story to your grandchild, only to hear them say gently, "You already told me that one, Grandpa." You smile, but inside a quiet fear begins to take root. Memory slips happen. That's part of aging. But what if it's more than that? What if you find yourself struggling to keep up with a conversation, forgetting how to use everyday objects, feeling overwhelmed doing tasks you used to enjoy, getting lost on familiar routes, not recognizing your own handwriting or forgetting appointments, even important ones? Or maybe it's not your memory at all, but your mood. You're more irritable, more withdrawn. You find yourself snapping at loved ones or just wanting to be left alone. These aren't just senior moments. When memory issues become frequent or when your personality seems to shift in ways you can't explain, it may be a sign of cognitive decline, a gentle but real change in how your brain is functioning. This doesn't always mean Alzheimer's or dementia. That's a common fear, but it's not the only answer. Cognitive changes can also come from vitamin B12 deficiency, which is more common as we age and affects brain health, thyroid disorders, which can slow thinking and cause depression, medication side effects, especially sedatives or sleep aids, depression, grief, or chronic anxiety, all of which can mimic memory loss. Even dehydration, sleep problems, or hearing loss can make it harder for your brain to function clearly. And when it is dementia, the earlier you detect it, the more power you have. You can plan. You can adjust your routines. You can involve your family. You can hold on to your independence longer. instead of watching it slip away slowly and silently. Let's talk about James, 82, a retired high school history teacher. He loved crossword puzzles and Civil War trivia, but over a year his daughter noticed changes. He was repeating himself more. He paid the gas bill twice in 1 month. He left the stove on. James waved it off as being tired, but eventually he agreed to see a neurologist. The diagnosis: early-stage Alzheimer's. It was heartbreaking, but it gave James a chance to speak openly with his family, to get support, to start memory therapy early, and to find peace, not panic, in the days ahead. Please remember this. Your brain has held your life story. It has stored your first love, your proudest days, your greatest sorrows, and the laughter of your grandchildren. You deserve to protect it. So if you feel like something's changing, your memory, your moods, your sense of time, don't keep it to yourself. Talk to someone you trust, see your doctor, schedule a cognitive screening. There is help, there is hope. And no matter what the diagnosis is, you are not your memory. You are your spirit, and with love, support, and attention, you will not walk this road alone. Final message: you still matter. If you're watching this, take a deep breath and know this. You're still here. You're still needed. And it's not too late to take control of your health. Your body isn't just aging, it's speaking to you. And when you listen, you give yourself the power to protect what matters most: your time, your independence, and your memories with the ones you love. These signs we talked about today aren't meant to scare you. They're meant to empower you. Because even one small step, making that call, asking that question, could save your life. You're not alone. We're here with you at Faith Wisdom, walking this journey by your side. If this helped you, please like the video, share your thoughts in the comments, and subscribe to Faith Wisdom for more care, comfort, and truth made just for you. You're still writing your story. Let's make the next chapter a healthy one.